Today, we explore how eye movement desensitization and reprocessing, or EMDR, benefits the African American community dealing with post-traumatic stress disorder, or PTSD. The best way to learn about this is from the client's and psychologists' perspectives. Clara is a doctor struggling to cope with the death of her patients and colleagues during a hurricane rescue. She has opted for EMDR therapy to address her distress, as it focuses on directly addressing the reduction in the vividness and emotion of traumatic memories related to her inability to assist in the rescue. Clara selected Dr. Greenlee due to her Level 2 EMDR certification, extensive knowledge of historical injustices, strong empathy for individuals of color, and emphasis on fostering trust within the therapeutic alliance. Dr. Greenlee utilizes EMDR due to its bilateral stimulation and 8-phase approach and established effectiveness in assisting African American individuals in alleviating symptoms of PTSD, post-traumatic cognition, and depression. Now that we have met Dr. Greenlee and Clara, let's take a look at Dr. Greenlee's notes for the 8 phases session. Phase 1. Clara is struggling with persistent feelings of anxiety, guilt, and flashbacks. Phase 2. Dr. Greenlee explains the EMDR process and demonstrates the bilateral finger movements. In Phase 3, they use scales to evaluate her emotional and cognitive responses toward losing her colleagues. Phase 4 desensitization is the treatment phase. The video demonstrates a session. Watch the fingers as they move, and it helps to get rid of the memory until it is no longer distressing. Phase 5 aims to reinforce the positive cognitions that Clara and Dr. Greenlee chose. Phase 6. Clara monitored her physical reactions while reliving the trauma. Clara indicated no distress during the observation and experienced positive thoughts while recalling the traumatic event. No additional bilateral stimulation needed. Phase 7. Concluding the session involves employing techniques to contain any remaining distress and ensure the client's safety until the next meeting if the targeted memory is not fully processed. Phase 8. Dr. Greenlee evaluates Clara's current psychological state, reviews the effects of treatment, explores any newly emerged memories, and sets goals for their upcoming session together. The 8 phases emphasis on empowerment makes it a more inclusive and effective path to healing. Things to remember about EMDR and PTSD. Choose a therapist educated with EMDR. Prioritizing trust in the therapeutic relationship. Adjust the pace of your treatment to maximize its benefits. Below are the references. Have a good day.